everyone, welcome back. I'm Jin Su. In the previous session, we discussed critical thinking in nursing. In this session, I'm going to introduce nursing process to you. In nursing, this process is one of the foundations of the practice. It offers a framework for thinking through problems and provides some organizations to nurses' critical thinking skills. By the end of this session, you will be able to describe the phases of nursing process and identify major characteristics of the nursing process. Now, I'm going to explain the nursing process and briefly overview each stage of it. Then, in subsequent sessions of this unit, we will look at each stage individually. Nursing process is a systematic, rational method of planning and providing individualized nursing care. Its purpose are to identify a patient's health status and actual or potential health care problems or needs, to establish plans to meet the identified needs and to deliver specific nursing interventions to meet those needs. The nursing process was first introduced in the late 1950s, and since then, many nurse experts have described the process of nursing and organized the phases in different ways. Until now, it is being modified and developed continuously. Many nursing associations and educational institutions use 5 phases nursing process: assessing, diagnosing, planning, implementing, and evaluating. The phases of nursing process are not separate. They are overlapping, continuing sub-processes, such as assessing. The first phase of the nursing process is also carried out during the implementing and evaluating phases. For example, while administering medication, the nurse continuously notes the patient's skin color, level of consciousness, and so on. Each phase of the nursing process affects the others. They are closely interrelated. For example, if inadequate data are obtained during assessing, the nursing diagnosis will be incomplete or incorrect, and inaccuracy will also be reflected in the planning, implementing, and evaluating phases. Nursing process has distinctive characteristics that enable nurses to respond to the changing health status of the patient. These characteristics are cyclic and dynamic nature, patient-centered, problem-oriented, planned and goal-directed, focused on problem-solving and decision-making, and its universal applicability. Nurses must use a variety of critical thinking skills to carry out nursing process. Let's look closely at the 5 steps of nursing process. The first step in nursing process is assessing. In this phase, data is gathered about the patient, family, or community that the nurse is working with. In assessing phase, nurses collect, organize, validate, and document patient data. The purpose of it is to establish a database about the patient's response to health concerns or illness, and the ability to manage healthcare needs. The assessing activities can be obtaining a nursing health history, conducting a physical assessment, reviewing patient records, and so on. The second phase of nursing process is diagnosing. Nurses analyze and synthesize data in this phase. The purposes of diagnosing are to identify patients' stress and health problems that can be prevented or resolved by collaborative and independent nursing interventions. Nurses will compare data against standards, group data, identify gaps and inconsistencies among data, determine patients' stress, risks, and problems, formulate nursing diagnoses and collaborative problem statements, document nursing diagnoses on the care plan. For example, during the assessment, the nurse recognized that the patient feels anxious and difficult to sleep. The nurse diagnosed those problems with nursing diagnoses, anxiety, and disturbed sleep pattern, respectively, by clustering patients' data, comparing the data with the definition of the relevant nursing diagnosis. Based on the diagnosis, nurses then develop the nursing care plan for the patient. The purposes of the planning are to develop an individualized care plan that specifies patients' desired outcomes and related nurse interventions. In the phase of planning, nurses can set priorities and goals or outcomes in collaboration with patient, write goals or desired outcomes, select nursing strategies and interventions, consult other health professionals, write nursing interventions and nursing care plan, and communicate care plan to relevant health care providers. The fourth phase of nursing process is implementing. In this phase, nurses carry out and document the planned nursing interventions. The purposes of implementing are to assist the patient to meet desired goals or outcomes, promote wellness, prevent illness and disease, restore health, and facilitate coping with altered functioning. In the phase of implementing, nurses can reassess the patient to update the database. It is important that before implementing an intervention, the nurse must reassess the patient to make sure the intervention is still needed. Nurses also must determine the need for assistance. When implementing some nursing interventions, the nurse may require assistance for some reasons, such as being unable to implement the nursing activities safely or efficiently alone. Nurses must perform planned nursing interventions based on science and evidence, provide safe and holistic care, respect patient, and communicate with patient of what nursing actions were implemented. Nurses also need to supervise delegated care and at last to document care and the patient's response to the care. The last phase of the nursing process is evaluating. The purposes of evaluating are to determine whether to continue, modify, or terminate the plan of care. Nurses will collaborate with patient and collect data related to the desired outcomes, judge whether goals or outcomes have been achieved, make decisions about problem status, review and modify the care plan as indicated, or terminate nursing care. Document achievement of outcomes and modification of the care plan. Evaluating is the last phase of nursing process, but it's not the end of the nursing process. Again, each phase of the nursing process affects the others. They are closely interrelated. At the end of the first cycle, care can be terminated if goals are achieved. The cycle may continue with reassessment and the care plan may be modified. Nurses must use a variety of critical thinking skills to carry out the nursing process. Okay, that's all for the overview of nursing process. In next session, we will study the assessment phase in details. Thank you for your attention. See you next time.